Well, welcome everyone to this AANS Leaders of Neurosurgery series. And it's really my great pleasure to be here this morning with Dr. Raymond Sawaya, who many of you know. He's the founding chair of the Department of Neurosurgery at MD Anderson Cancer Center in Houston, Texas. And really, he's an absolute giant in the field of neurosurgical oncology. And I'm really happy to be here this morning interviewing Dr. Sawaya about his career and to give us some insights and lessons that he's learned over his illustrious career. As most of you know, he's been a major contributor in both the area of clinical work on brain tumors, but also in research, education, and as a leader. His work over the years has focused on improving the surgery for primary brain tumors. And he's done really seminal work on the extent of resection in brain tumors. And he's made major contributions to the area of brain metastasis, really almost defining the role of surgery in brain metastasis early on. So it's really a great pleasure to be here this morning with you, Ray, and welcome to this interview.
I'm delighted to be with you, Fred. I consider you a family member. And thank you for the generous introduction.
Excellent, excellent. So let's get started. I have a couple of questions. We'll sort of start maybe in the beginning of your career and span through your career to get some of your insights and things that influenced you along the way. So if we go way back to the beginning, I know that you actually grew up in Syria and that your father was a cardiologist and had a great influence on you, and that your mother was a very strong personality in your early development. So can you give us a little background on the role that your family played in your career?
Absolutely, and you're very right, Fred. You know, when we grow up as young people, sometimes we don't appreciate what we were given in terms of education, growth, love. And you mentioned my father and mother. Certainly, my mother was a strong, loving presence at home. And when you get that kind of love, it gets into you, and you wanna share it. My father, on the other hand, was a very loving man, but he was a physician, as you said, and he was a true role model for me. Growing up as a teenager, I would go with him to people's home, and I would be influenced by his approach to the whole family. And so, at this age, and I look back at this era, I say, oh, thank you. Thank you for having been given this kind of love, this kind of early apprenticeship, if you will, to medicine and to health. So yes, I miss them, and they remain major presence in my life.
Yeah, it's wonderful to hear. I think many of us always appreciate our parents and setting that foundation. So from there, you went to medical school, not in Syria, but actually in Lebanon, at St. Joseph's, I think, was your medical school. And you met some important people in there that influenced your career. Can you tell us about that and their effect they had on you?
Absolutely. I think, we are a neurosurgical society, so it's very important to understand the neurogene. I separate physicians between pro-neuro and anti-neuro, if you will. I mean, to know that you are passionate and fascinated by the nervous system is, in my view, a critical element in choosing the field. And I think a medical student that is thinking about a neuro specialty, neurosurgery in particular, if they don't have that passion, then maybe they're picking the wrong field. So I was fortunate in medical school to have discovered that I was really, truly passionate about neurosurgery and the nervous system. And along those lines, I run into a giant of neurosurgery in the Middle East. His name is Fuad Haddad. Fuad trained by Wilder Penfield at the Montreal Neurological Institute and returned to Lebanon to head the neurosurgery program at the American University of Beirut, which is a major university and a major medical center. And he started the first neurosurgical training program in the whole region. And so imagine, as a medical student, to have been introduced to Fuad. Not only that, he took me under his wings. He took me as his private intern for a whole year. I was a senior medical student at the time and definitely committed, as I said earlier, to go into the neurosurgical field. So you have a giant like this who was doing his own angiograms, his own myelograms, his own EEGs. I mean, he got all that from the Montreal Neurological Institute. As you know, they were very well integrated there. And the knowledge of the field was, for me, definitely not only an eye-opener, but it opened the door for me to go into neurosurgery.
Excellent. And so people come into our lives. It's very interesting how they influence you. And then I know you decided that you wanted to go to the United States to do trainings, yes. And I think Dr. Haddad influenced you greatly that would be an important part. So tell us a little about that. I know it wasn't an easy transition, and what was the lesson you learned there?
Yes, well, in my own situation, as you said, St. Joseph is a French-led university run by Jesuits. And my diploma actually is signed by the French education minister. Why am I saying this is because all my classmates would go, who want to specialize, would go to France. We were French educated, a French medical school, French diploma. So you go to France and doors open for you there because you are one of them. Well, neurosurgery in the early to mid 70s, well, really, truly the only place in the world at the time was the United States, and maybe Canada, of course. But France has history, strong history, but during that era, they were not prominent. Of course, now we have many other countries, Japan, Germany, Korea. I mean, many, many places where you could train superbly in neurosurgery. Back then, it was the US. So obviously, I put my sight on the US. I took the ECFMG exam, which you must take to be accepted in the US. And then I applied. I applied to, as you probably remember, some 300 institutions. I had to type every letter, put a stamp, no emails, no computers back then. And I got no acceptance. I mean, this is the hardship that I faced at the time. But, we tell our students, never give up, stay on it, stay on it. I was introduced to somebody in New York City, of all places, in Beekman downtown. I know you know Beekman because you were at NYU and you are a New Yorker. So I went in as an intern, surgical intern, small hospital, private hospital, not strong academics, but actually this is what I needed. I needed that to get into the US American medical surgical system, learn the language, which I was not strong at the time, being French educated. So that year was a truly phenomenal transition year that got me into the system. And from there, I went to Syracuse. Now, why did I go to Syracuse? Because the chairman of neurosurgery there, Bob King, another giant of neurosurgery, was a friend of Fuad through the Montreal Neurological Institute, and he had sent Lebanese graduates to train with Bob. So Bob was open to the idea. He knew the strength that the American University in Beirut presented, And so I went there to do a year of general surgery. I did not feel ready for neurosurgery. I wanted to do a year of general surgery. And this was 75, 76, another great year in a good university. But when I was finishing that year, Bob did not have a position. He would take one resident per year. And so I was so heartbroken that he didn't have a position for me, but he did help me. He wrote to a number of his colleagues across the country. I received several offers, and it's happened that Cincinnati was the first one that opened its door for me. And so I immediately took it and accepted the residency at the University of Cincinnati.
That's wonderful. So it sounds like you had to have a lot of grit. How did you get through those years emotionally? I mean, you mentioned disappointment. What would you say to, young people, especially people coming from outside the United States, trying to get a position in the United States? What's an important lesson that you learned from this that, you could tell that some of the younger people?
Certainly not giving up. Just like when I applied from Lebanon to the US, if I gave up, then, nothing would have happened. So not giving up is certainly one. But I must say that the reason I admire so much the system that we have in the US, it is truly meritorious. It just happened that program didn't have a position, and I had to accept that despite the hardship and the sadness that I really wanted to train with Bob King. It was somebody that I looked up to. And we can spend a lot of time talking about Bob King, but that's not the purpose of this discussion. So you have to work hard. You have to commit to doing excellent work. You have to commit to learn as much as you can learn. And for me, those 2 years between New York and Syracuse, it gave me a chance to really understand the system, function well within the system, while knowing that there's a lot I don't know. When you're a junior resident, there's so much we don't know. But if you recognize that there's so much you don't know, then, hopefully you will focus on that. And that's what I did. And that led me into neurosurgery at the University of Cincinnati.
Wow, that's a great lesson, that take it upon yourself to keep moving and keep educating yourself to get better within, so that you can earn where you want to go. Very important lesson. So I know that you took a little time in there to go to NIH, and you kind of had your training started in Cincinnati, but you had some jumps in there like NIH. What influenced you there, and what was your reasoning for wanting to go to
Yes,
NIH?
it's a very, very critical part in my life. As a resident at the University of Cincinnati, it was a small program. And as you recall, it was in the 70s, which means microneurosurgery was just starting. It certainly was not routine. Many programs did not employ the microscope for the surgery. And as I finished, although I felt I was well trained as a general neurosurgeon, I did not feel like I acquired what I needed to acquire in terms of microsurgical dissection and be at ease with the use of the microscope. So I asked my chairman, Bob McLaurin, who was very supportive, if he could help me get into a program where I could do that. And I applied to 2-3 programs. Don Long at Johns Hopkins immediately responded yes. And that started a great friendship between Don and myself, and we remain even after that time. The time at Hopkins was superb. I did a lot of microsurgery, and then back to your question, my goals really was to go back to Lebanon. Having worked with Fuad Haddad and seen the needs in that country, there were only 6 neurosurgeons in all of Lebanon, country of 3 million. There were 6 neurosurgeons. There should have been 30. There were 6. And I worked with 4 of them. So I wanted to go back to Lebanon, but there was a war raging, a civil war going on that lasted 15 years, from 1975 to 1990. So as I finished my fellowship with Don, it was 1981, I could not go back to Lebanon. My son was just born, he was a few months old, and I just couldn't take my family to a war-torn country. And that's where NIH came in the picture. I said, well, I have to strengthen myself academically now. Okay, I trained well, I believe. I think I'm a competent surgeon, but frankly, to thrive in the United States, in the concept that I had in my mind, I had to be successful academically. And what a better place than the surgical neurology branch at NIH, which is part of NINDS. Paul Kornbliss was at the time the head of the branch, and he had no positions. Till this day, many of our friends went there and still go there to do fellowships. Well, they had like 4 or 5, trainees in fellowship. They just didn't have position. Now, what worked in my favor was that I'm an international graduate. And there is the Fogarty International Fellowship that NIH started to train international students, doctors, surgeons, and many of them do go back to their countries. So I was given a Fogarty International Fellowship, which is actually quite prestigious, and allowed me to get in for a 2-year fellowship at NIH. And what's interesting, and I have to say it since we're reviewing history, I was not a tumor guy at the time. I finished my residency. I was general neurosurgeon, everything, vascular and spine and brain and whatever. But going to NIH is what really made me focus. Paul Kornbliss asked me in his interview, what do you want to do? I told him I want to study fibrinolysis in brain tumors. He almost fell off his chair. I mean, nobody talks fibrinolysis. What do you mean? Well, I wanted to study the proteases that make the glial tumor cells invade the brain. I mean, and we know now that there are proteases that allows those tumor cells to break down barriers, break down fibrin, and spread, and so on. So I had this idea, which in retrospect was very smart because it was novel, it was new, nobody was studying. So the potential of discovery was great. And so Paul Kornbliss was sold right away. And he gave me the opportunity, and I did. I did a lot of work in this there, and then I moved to Cincinnati for my first faculty position.
So that time in NIH, it sounds like you actually were driving a lot of the project. What did you learn about science in there, and what did you come to appreciate about science and how that influenced you future in terms of the project you were doing and the way you were going about it?
Yeah, absolutely. I think that the biggest lesson is, as you know, science is team science. Okay, you come with the idea. Yes, you want to be innovative and so on, but guess what? You're not going to do it alone. And what NIH provided me was a plethora of scientists, physicians and non-physicians who work there, and they have in their persona the will and the want to help and to mentor and to teach. The environment at NIH is really equal to none, until we may come back to this later on in your question, until I got to MD Anderson. And at MD Anderson, we'll come back to that, Fred, I'm sure, was the ability to create the same environment, not 100%, but the same concept of working together. And anyhow, we'll come back to that, I'm sure, later.
Very interesting. Great. So now you're at University in Cincinnati. This is your first position there. Tell us a little bit about that experience. You know, what made you successful in this first job? And for new neurosurgeons who are just starting out, what are some of the insights you had from that, and how did that influence what you did later?
Yes. So there are two aspects to your question. One was that there is no small job. Whatever opportunity you're given or find, take it. Because what I've learned from helping with the residency program, I was not the program director, but I acted like the program director because they delegated the stuff to me. So I've learned a lot about training programs and curricula and so on. I was given the responsibility to build a brain tumor program. Now, small program, so I didn't have the resources that we eventually got to have, you and I at MD Anderson, but it allowed me to think about what a program should have. Example, nurse, neuro-oncology nurse practitioner. There were maybe a handful in the whole country. It just wasn't a concept. But I recognized that as a busy surgeon, spending a lot of time in the OR, residents in the OR, somebody needed to see those patients. Somebody needed to follow up on them, to order their scan, to order whatever. And I tried to get a neuro-oncology nurse, and I just couldn't. The resources were not there. And but I did. I persisted, and I did get wonderful Julie Senegor was her name, and she remains a dear friend of mine. She lives in California now. But that's just an example of thinking of what is an ideal setup to build a brain tumor program, including the labs, including getting grants. So even though it was a small program, I was able to think through and, in my mind, develop a vision for a brain tumor program. And that's truly critical because it was the apprenticeship that allowed me to move into MD Anderson and to succeed there.
Yeah. So you then, I guess, how exactly did you get to MD Anderson? Because MD Anderson at the time didn't really have a neurosurgery department, oncology department, and I guess Victor Levin came to MD Anderson to help form a more formalized neuro-oncology group, and as we know, Victor Levin was a giant there.
Yes.
So tell me a little bit about that transition, and at the root of my question is sort of why were you willing to move to a place really that had no history and what was really, you might call, a startup at this point?
Yes. So I think part of it was the struggle I was having in getting resources. I had my own lab, I had my own grants, I was busy surgically, but to grow the program, you need resources that the institution must commit. And I was just not getting, it was a struggle for many of these resources. That's number one. Number two, and I feel strongly about it, the compensation model that was applied at the time was pure private practice compensation model, which means that every time I went into the lab, it was like, money taken out of my pocket. Okay, not that I wasn't in it for money, but you need fairness. You need a system that is going to recognize your research effort and compensate it at the same time. Of course, I applied that, as you know, at MD Anderson. So I had this struggle, and then MD Anderson gives you a chairmanship. Okay, yes, you're right. It was a very small program at the time, certainly not on the map, but it was a department in a major cancer center. So it will focus my effort on oncology as opposed to having to cover trauma or to do, benign degenerative spine work and so on. So So that, I mean, it was an incredible opportunity to be accepted and taken into MD Anderson. And I will emphasize for those who are thinking about building program in the future, it's what I did at University of Cincinnati. I built a lab, I built a practice, I published. All this got my name to be recognized, although I was not certainly one of the big names. I was junior, but it's the promise based on what I did at University of Cincinnati that got me the job at MD Anderson. Excellent.
So what you go to MD Anderson, big opportunity, sort of the sky's the limit. What was your thinking about what were the foundational elements, so to speak, that you wanted in this program to make it grow, and how did you implement them, and then how did that lead to what you were hoping for?
Yeah. So there is a historic element here that worked to my favor and to the favor of the institution, is that MD Anderson, although it had a big name, it was not yet the top cancer center. So I arrived, to my fortune and luck, at a time when the institution was wanting to grow, wanting to really reach this top rating. And so, they gave me, my package was 4 faculty, 2 neurosurgeons who were there, and myself, and 1 additional position. That was it. That's what the package. But guess what? I was delighted to take it. But I'm telling you this because, and as you know very well, every year I was able to hire a neurosurgeon. So forget about the 4 they gave me. It was a starting package. But being at MD Anderson at that time in 1990 to 1998, that period of tremendous growth was the one that allowed me to put in place the elements of what we have today.
Excellent. So you grew the program tremendously over the years. You put MD Anderson on the map as an incredible neurosurgical oncology program. The fellowship is developed. You start training people. I don't know what would be, you evolve into a leader, which I always thought you had in your core. But what are some of the lessons around leadership that you can tell us about? What are the fundamental important things about leading a program like this and making it grow?
So this takes me back to some of the things we talked about earlier. Every one of these giants I was so lucky to work with taught me something. I told you about Fuad Haddad, who built a whole service almost like MNI single-handedly. I told you about Bob King, who was one of the best academicians in neurosurgery committed to education and research. Bob King was the president of the American Board of Medical Specialties, not only of neurosurgery, of medical specialties. He was so committed to the board recognized training. And I learned from him. I watched him work. John too is a master negotiator. John too would never get a new tool, a microscope or a laser and pay for it. Never. He always got the companies, because of his name, to donate to him. And so I learned from John, how to be savvy about the business of neurosurgery and how to negotiate either with the companies or with the hospital, the institution that happens to have the money and so on. So it's really, I can't pinpoint one thing. I think it's a cumulative effect. And as I said earlier, in Cincinnati, there's no too little a job. You take it, you learn from it, you grow with it, and then if you're lucky to be able to delegate it to somebody else, then you turn it over to somebody else.
Yeah. So one of the things that came out of the program was this idea of subspecialization. And as you know, we have the neurosurgery tree, which if people have been at MD Anderson, they get a little plaque and has this tree on it. Can you tell us a little about what that tree represented and how that sort of outlined the whole program that you developed?
Absolutely. I think it was the vision behind building our department at MD Anderson. But I think it starts with the subspecialties. At the time, remember 80s and even 90s, most programs didn't have a dedicated oncology neurosurgeon. Most programs did not. And those who did, they did mostly gliomas and spine tumors because of the spinal cord compression and so on. I happen to have been a founding member of the North American Skull-Based Society. Shekar was a dear friend of mine, and Al-Mufti, a dear friend of mine, and we used to socialize. So I was with that group, but I realized it's not for me, that I cannot be as good a skull-based neurosurgeon as I would want to if I wanted to focus in this field. And believe me or not, this was the impetus behind saying we have to develop each aspect of neurosurgical oncology with the best expert. Of course, fast forward a little bit, not too much, we got Ziago Caslin to come, who did fellowship at NYU, and who, we credit him for having you coming down our way. But, when you get somebody like Ziago Caslin committed to spinal oncology and pushing the envelope and doing the most sophisticated, the most complicated, I couldn't do that. And I shouldn't be doing that.
Right.
Same thing with skull-based. Even pituitary tumors, I used to enjoy doing them, but it really takes a special passion and interest in doing that. Cancer pain, we got Sam Hassenbusch, most beautiful guy in this field, to develop the cancer pain program at MD Anderson. So I think the most important contribution, I believe, was to recognize and develop. This is why I was adding a surgeon every year to cover all those different areas.
Yeah, I would have to agree. You were early adopter or recognized that, I guess you'd say, super subspecialization inside this area was critical, and I would agree that was a critical element to the growth of the program. The other thing you also did a lot of research, right? And I just want to give us a little background about your seminal paper on extensive resection, and particularly how that related to your other great idea, which was critical to the department, which was the database. And maybe tell us a little about how why you developed the database, and then how important that's been in your research.
Absolutely. The database started in Cincinnati. I hired a Chinese neurosurgeon who couldn't practice in the US, but understood neurosurgery and the data behind our patient. So he was my fellow, if you will, or my research assistant, going after every patient that I operated on, collecting information, collecting images. There were no PACS system at the time, of course. And so I understood back then that if you want to do real clinical research, you have to collect real data on real patients. Fred, you served as the clinical director of clinical research at MD Anderson, and we have, and you have, clinical trials, but the clinical trial, which is very important in itself, only asks a narrow question about a single issue. Should you use this stitch or that stitch? Should you approach it this way or that way? I mean, that's fine. They're a good question, and the answers are very valid. But in my mind, we do so much more, and data that gets lost. And so I wanted a comprehensive database that collects everything about every patient: imaging, volumetrics, blood loss, lengths of stay, outcome, complications, everything that we all can learn from, and that cannot be answered by a clinical trial. And so that's really was, but it had to be a well-constructed database done professionally. I started it, it was amateurish, it was nothing professional. It got me started. It got me to have questions and ideas. One question I had in mind, which we may talk about it, about metastasis, was should we remove a metastasis, brain metastasis, en bloc, meaning don't enter it, don't suck it, don't debulk it, which is the term that neurosurgeons use for decades. Can we do a cleaner job, a more complete job, and maybe not spill tumor cells? So that was a question that was entered in our database. And as you know, we've learned a lot about that and the benefit of en bloc resection versus piecemeal. You could not have done that if you didn't first ask the question and second, enter the elements into the database that allows you to go back later and get the answers.
Excellent, excellent. I agree 100%. The database has been critical to many questions that in both metastases and primary tumors. So you build this great program at MD Anderson, and you retire, and we thought you were going to relax, but you now are the Dean of Faculty of Medicine back at your home in Lebanon at the American University in Beirut. Can you just give us a little advice for the later part of people's careers, for people who are, approaching sort of the latter years of their career? What advice did you give, and why did you go on to take this job?
Yeah, well, I think a couple things are important here. From my perspective, I was fortunate to be surrounded by truly phenomenal, outstanding people. And you, Fred, you are near the top of that list in my book. Why do I say that? Is because, yes, I did build the program, and yes, we continued to thrive and grow. But it was obvious that there comes a point where you have to step down and give the opportunities to the more junior people who are equally, if not more talented, and who can bring a new fresh breath into the program. And I know you have done that because we have remained in touch. That's a factor. That's a factor. But there's another factor that would be relevant to some of the listeners, and that is, as you grow and you age and you have done and you're accomplished and all of this, you want to transition, not only step down as chair, you want to transition into something else or something different that would be more appropriate for your level of growth and development and so on. And I know but I want the audience to know that there was only one job that I wanted in the United States, and that to be president of MD Anderson. It just, for me, to be able to apply the vision that I created for neurosurgery and eventually for the brain tumor program, because we haven't talked about this, the fact that we could all come together, all the neuro-oncology related expert and contributor from medicine to surgery to radiology to radiation to psychology to pathology. I mean, they're all, to solve the problem of brain tumors. we need all of us to be together. And I wanted, as you know very well, to have all of them under one umbrella, under like one unit. We're all called neuro, so we're under one roof. I think MD Anderson is one of the very few places that could do that, because we're a cancer center. We're not a medical school where you have to worry about all aspects of neurosurgery and all other aspects of neurology. And so we're all speaking the same language of oncology. It happens to be neuro. And so I had dreamt and tried to lead the institution to do that, but it happened that I was not given that opportunity. And so I continued doing that. And I'm telling you this because when the offer came from the American University of Beirut, it provided me with two things. One, bring me back home. I mean, somewhere deep in your heart, thinking of my mom and dad, this, even though, the United States has been incredibly generous for me and open every door, and I can't say enough about it, but this is an institution that means something to your heart. It's something that is worth them. Yes, I mean, I could have retired, as you know, and enjoyed travel and all of this, but to be able to come here to an institution, a serious institution that is in need during these time is special. And so I did not hesitate. When they offered me the job, I took it.
Excellent. Well, Ray, we're coming to the end here. I just want to thank you for sitting down and talking with us about your career and giving us all these incredible insights. I think it comes across very clearly that you're not only an incredible thinker and innovator, an incredible leader, incredible mentor, but you're a very warm and very easy to get close to you, and you really care about people. And I think that's been one of the qualities that has distinguished you along the way and made you successful. And I always say that you started out as my teacher, and then I actually started working for you, and you were my boss, and eventually you became a great friend. And so I really appreciate you being here in this AANS leadership series of neurosurgery series. So thank all of the people for joining in. And Ray, I'm going to give you the final word.
Well, I've been very lucky and to be associated with you, Fred, and the colleagues that you have with you and with me that go back to 30 plus years, the Franco de Monte and the Ian McCutcheon. And of course, I don't have time to go down the whole list, but you're all special. I'm the lucky one. And thank you for this recognition, for these warm and kind words. And good luck to all our colleagues, especially the junior ones. Bright things are ahead of you. Neurosurgery is a phenomenal field. I would never do anything else. And now I have the perspective. So thank you again for this wonderful opportunity. Take care.
Thank you, Ray.